we saw a lot of studies in humans about correlations between cell phone use and behaviors and behavioral alterations, ADHD, behavioral alterations like that in children of women who are on their cell phones a lot during their pregnancy. So I started to wonder whether that really was causative. There are people who dismiss some of those studies. Well, of course, if a woman's talking on her cell phone all the time and ignoring her kids, they're going to have behavioral problems. No, we thought it would be a lot more than that, that there probably really would be cause and effect. So we did an animal study, and we were the first to do a study to specifically look in a mouse model. And here we just took regular old cell phones that everyone was using, put them on top of the cage. The mice that were pregnant or had a cell phone that was deactivated on top of the cages of half the mice in separate rooms, and just similar to human exposure, and exposed to these cell phones throughout their pregnancy. Nothing, same genetically background mice, the same environment, the same diet. There are no other confounders in there that would have potentially interfered with this. The only variable that was different is whether they had that cell phone on or not. So we could really say it was caused by the cell phone. And this is what we found. I'm sorry, this may be a little bit small for those of you to see, but the first one here looks at memory, and the one with the open circles are those that had the cell phone exposure. And you can see that their memory was decreased. They were much more hyperactive, and their anxiety was actually lower. So they were bouncing off the walls, not remembering what they're doing, but didn't have a care in the world. It didn't bother them. So again, very, very similar to what we see ADHD. So a good mouse study that really proved that. Others have done that, and I won't go through all these because I think it'll overlap a little bit with our next speaker, but there are other studies that have come on since this time that have seen those same sort of correlations in women, especially women who are pregnant, who use cell phones during their pregnancy, and children having various behavioral problems due to that cell phone exposure. And other animal species, even the zebrafish model has been used as well, where you can expose a fish to cell phone radiation and see various types of abnormalities, including the type of behavioral abnormalities we saw in mice. So it's correlative in humans, and we see it very clearly in our mouse models, and it affects all sorts of other species as well. This is broadly applicable. Really don't use your cell phone or wireless laptop, certainly on your abdomen. A laptop probably shouldn't be on the lap, especially if you're pregnant. And keep it away from you. Don't sleep near your cell phone. Put it away from you when you're in your car driving. Put it on the other side. Turn it off. Put it on non-broadcasting airplane mode whenever possible. And just generally minimize your exposure, especially when you're pregnant. Especially keep it away from your abdomen, because the fetus really is vulnerable. I want to say we'll never have perfect evidence in women, so we're not going to expose women to things that we think are harmful and test whether it's harmful or not. We're not going to do those experiments. It's going to be correlative experiments, and somebody will always say, well, the women using the cell phones, the women exposed to this particular chemical had all these other exposures. How do you know that was really what's causing it? And you can't in these human studies. But in animal studies, we can do that. We can isolate it so they're completely identical. Again, the same genetic background, the same diet, the same exercise regimen, the same light-dark time, everything you can think of, these animals are identical except this one exposure. Whether it's one of the endocrine disruptors I talked about, whether it's the cell phone radiation, we can do those experiments and we can show that it's cause and effect. There's nothing else different between those two groups, and one has these adverse outcomes. So when these two align, I think we have pretty convincing evidence that when you show its cause and effect in an animal, and when you also see the correlations in people, I think we can be pretty convinced that really this is truly causal in humans, and we need to watch out and we need to be more careful. What I've shown you, though, is just really the tip of the iceberg. I've talked about a few hormone-disrupting chemicals that I know about and have studied, and we know about quite a few. But there are many more out there. We live in a sea of thousands of chemicals. Our exposures to various electromagnetic fields is increasing and changing. I think these are all things that we really need to study more carefully. And although we don't have all the answers, we know that environmental exposures clearly play a role in the health of the next generation. And there are things we can do now to protect the next generation. from these exposures that may not even be manifest till decades from now, but we need to think and act now to prevent and protect our children. So, we can already identify some things as really very dangerous, some things as less harmful, but we need to do a lot more research to identify exactly all the different compounds out there and really quantify which are the safer alternatives and which are the really dangerous things that we need to avoid. Now, we know some of them, but as I said, it's just the tip of the iceberg.